The Caribbean Public Health Agency expresses concern about the supply of materials to test for the novel coronavirus.
Trinidad and Tobago's health minister discouraging the hoarding and use of some medicines.
The CDB provides package to cushion the impact of COVID-19 and other shocks on the region.
Welcome to the CARICOM News Time for the week ending Friday, the 10th of April. I'm Tusankin English Francis.
And I am Michelle Nurse. Thank you for joining us. The Caribbean Public Health Agency, CARPHA, has assured CARICOM health ministers that it is working with the Pan American Health Organization, PAHO, to avert any shortages in materials to test for the novel coronavirus. CARPHA's Medical Microbiology Laboratory currently conducts COVID-19 tests for several CARICOM member states. In its report to a meeting of the Council for Human and Social Development on Health last week, CARPHA said it was impacted by the global shortage of test kits and chemicals used in testing, as well as personal protective equipment. CARPHA says if the agency does not receive supplies on order within the next 2 weeks, its operations could be impacted. Even in those circumstances, CARPHA continues to work towards a 24-hour turnaround time to deliver test results to member states.
Minister of Health of Trinidad and Tobago, the Honorable Terence Dial Singh, has expressed deep concern about the shortage of life-saving treatments for patients who suffer from lupus, rheumatoid arthritis, and malaria. He said due to panic buying and hoarding, there is a shortage of chloroquine and hydroxychloroquine in the Twin Island Republic. The minister says the shortage of these drugs will severely impact the quality of life of persons who need them and who face price gouging when they do access limited supplies at pharmacies.
We have now placed those three categories of patients at risk. And having chloroquine stored in your house for which you have no use, for which you don't know how to use it, and if you attempt to use it, creates a danger to you, but it is now hoarded in your homes. And the three categories of patients, I want to say it again: malaria, rheumatoid arthritis, and lupus, cannot access this drug.
The minister said he has spoken to the president of Trinidad and Tobago's pharmacy board to address the availability of the drugs at normal prices. The minister emphasized that there is no credible scientific proof that the drugs are effective treatments for the novel coronavirus. More so, the use of the medication is dangerous, especially when taken by people with little or no medical knowledge.
These patients will have a very bad quality of life if they cannot have access to this drug. It is useless at home. Return it to the pharmacies, please, and make it available to the patients who need it. And I will end by saying you could contact the various organizations on their Facebook pages that treat with lupus. It's a very close community. It's a very serious community. It's an autoimmune disease. They need the drug more than the individual who has hoarded this drug at home.
The Caribbean Development Bank, the CDB, says its goal is to ensure borrowing member countries get access to appropriate financing during the COVID-19 pandemic and to be their partner in the post-crisis recovery period. The bank has approved up to $140 million to support its members through the pandemic and other shocks to their economies, including natural disasters. In a release on the 3rd of April, the CDB predicts at least 1 to 2% could be shaved off previous global growth estimates as a result of COVID-19. The impact on the Caribbean could be much more profound, so the bank is increasing the limit on its policy-based loans. The CDB is also making available US $3 million for the procurement of urgently needed medical supplies for its member countries to effectively respond to the COVID-19 outbreak.
The CARICOM'S Secretariat has established a COVID-19 info hub that aggregates what is happening across the region. You can access the COVID-19 page via today.caricom.org. The hub features a regional dashboard with up-to-date information on the number of confirmed cases, recoveries, and deaths in each CARICOM country. Users will be able to browse COVID-19 information by country to follow actions member states continue to implement to abate the spread of the virus. In Jamaica, where confirmed cases have climbed to more than 60, Prime Minister Andrew Holness has announced that the government will extend the current island-wide nightly curfew. Other measures to address the COVID-19 pandemic, including working from home and closure of the island's borders.
The measures that we have contemplated are designed, as I said before, to allow as much economic activity as possible without compromising the health of our people. We must maintain and reinforce the safeguards and measures that have resulted in our successes so far.
The government of Jamaica is also moving to convert its national arena into a 72-bed field hospital to respond to any surge in the local coronavirus cases. If you visit the CARICOM Secretariat's COVID-19 page, you will also see that the number of cases continue to increase, even as the number of recoveries edges up. Trinidad and Tobago has surpassed the 100 mark of confirmed cases. The government has moved to tighten measures to curb the spread of the virus, including mandating wearing of masks by all persons when outdoors. The government issued orders for the closure of all restaurants and changes of the operation hours of businesses.
The government takes the position that the stay at home will go until April 30th, and we will take additional action to intensify the compliance of that instruction.
Recognizing that the COVID-19 crisis is rapidly altering social and economic orders, CARICOM has launched a survey to gather data and analysis on the impact of COVID-19 on food security and the ability to earn livelihoods. Prepared by the World Food Programme with support from the Food and Agriculture Organization, the survey contains 15 questions and takes less than 5 minutes to complete. You can access the survey at the link below.
As the COVID-19 pandemic upends traditional education, the region is utilizing technology to ensure that children remain focused. School terms have been cut short since mid-March, and regular vacation has extended as part of measures to fight the virus. Free virtual learning platforms are being utilized extensively to counter the challenges in the education system. There are also teacher learning programs and support programs for parents on the learning process at home. There is, for example, an improved learning program in the Organization of Eastern Caribbean States with support from the United States Agency for International Development, USAID, Early Learning Program. We sought insight into these new ways of learning from the CARICOM Secretariat's Jennifer Britton, who is the Deputy Program Manager for ICT 4D.
I think that we are, one of the welcoming things for me is that I'm happy to see that persons have been willing to move seamlessly from in-person activities to online activities. The fact that we may not have been as ready as we could be as a region is always, of course, on my mind, but I'm sure that the educators are working very hard on it, and you will note that CXC has been trying to push more and more products and services out to the community so as to help to lessen some of this divide. Obviously, though, there are persons in our region and all of the countries who are in what we call underserved areas and who may not be able to benefit immediately from the online activities that have been pushed by schools and other educational institutions. So that too is foremost on the mind of ICT practitioners as we continue to meet almost weekly to talk about how these problems could be alleviated in the short, medium, and long term.
The Guyana Elections Commission has signaled its interest in the return of the CARICOM high-level team to validate a recount of the March 2nd votes.
We'll be doing the normal things done at a polling station when you're counting. So all of the issues of reject ballots, of proxies, of stamps not being put on the ballot papers, all of those things will come up for review. The idea is to see if we can still get CARICOM involvement, not as supervising the COM, but as a presence that can give some credibility and validation to what GECOM does.
The decision to resume preparations for a full recount of the ballots was made after Guyana's Supreme Court lifted an injunction blocking the recount that had been requested by the President of Guyana. The President, in seeking to bring an end to the rising doubts about the legitimacy of the election results, had asked the Chairman of CARICOM to field a high-level team to supervise the recount. In its ruling on an appeal of the Supreme Court's decision, the Guyana Court of Appeal affirmed GECOM's authority in conducting its work. The Court of Appeal also nullified the exercise of supervision by CARICOM over GECOM's work.
It was always contemplated that CARICOM will, the word supervised was used loosely, I believe, but it was always that they would observe the process in keeping with the laws and the Constitution of Guyana. I have no doubt in very short order an approach will be made to the CARICOM Secretary General with a view of re-engaging that team.
Last week, we told you about CXC revising its examination strategy, including rescheduling the May-June examination to July. CXC is also urging teachers and students to fully utilize its e-learning platform in preparation for the exams. We spoke with two more students about their views on the impact of COVID-19 on their preparations for the CXC examinations. They also had some recommendations for CXC.
The revised strategy CSEC have introduced for the sitting of the 2020 examinations have both positive and negative impacts. Due to the COVID-19 pandemic, the administration of exams via the internet is wise and highly recommended. Candidates may have a better chance at procuring a good grade. On the other hand, the grade is based on the final SBA score and the score achieved upon completing a multiple choice question paper. A multiple choice question paper may not be able to assess all the necessary skills needed to successfully say that candidates have completed their 5 years of secondary school education. CXC has given us an extension to properly prepare for the revision, but they have not said whether it would follow the same pattern as previous multiple choice exams or if a new way of administration would be introduced. If they plan to use a new model, I suggest that they place specimen papers online so that candidates may be equipped with the knowledge they need to complete the examination. Also, many teachers have been making full use of the internet and are conducting classes to complete the various syllabi.
The CXC body has provided samples of e-tests on their website, which I have been using to my advantage, and also teachers have been doing online classes with this new quarantine that has proven to be very beneficial for my studies and for the continuation of the syllabus.
For more stories, you can visit the CARICOM news site at today.caricom.org or the CARICOM website at caricom.org.
Like our Facebook page, follow us on Twitter, and be sure to subscribe to our YouTube channel. Be safe and see you next time.